says go pop back in. Welcome, and we will call the meeting of the Rutherford County Benefits and Insurance Committee to order. You have received a copy of the minutes of the last meeting. Do we have a motion concerning their approval? Motion and a second, Mr. Sellers. Did anyone have any corrections or additions? All right, there being none. All of you in favor of that, please say aye. Aye. Any opposed? Okay, now we'll call on Ms. Stinson for a report on our financial condition.
Good afternoon. Today we're going to cover the October and November fund performance. If you refer to the insurance fund performance documents that I provided you, the per employee per month for medical and dental for October is $588.40 compared to $607.54 for the same period during the prior year. The per employee for medical and dental for November is $831.62 compared to $902.37 for prior year. The average per employee per month through November is $673.31, and that's down from prior year, which was at $686.70. When we combine the plan performance with the Care Here results through October, the total per employee per member plan cost was at $604.79 compared to $624.94 for prior year. In November, the per employee per month plan cost was $859.07 compared to $934.55 for prior year. Through November, year-to-date averages were $696.65 compared to year-end average of $718.92 per member per month for prior year. Currently, the plan is trending down at 3.1%. Is there any questions about the financials?
Does anyone have any questions of Ms. Stinson? I mean, the trend is good.
The trend is good. That's right.
And last year was a good year even in itself, was it not?
It was.
So we're still doing very, very good. Anybody have any questions? Ms. Harvey.
This is a little bit off the point. In January, we're going to be starting the fee for a misappointment at Care Here. Is that correct?
That is correct.
And it's $15. Is that what we agreed upon?
Yes, ma'am. That is correct.
Has that been sent out to the employees so they know that that's coming up in January?
Care Here is making an announcement regarding the $15. It has been on their website. At the point that you make appointments, there is an existing notice already so that individuals would become familiar with it, that it is an upcoming change.
Okay. Thank you.
Okay. Let's see, did we vote on that? Yes. I apologize for not introducing one of our new members to this insurance committee. Mr. Joe Russell, who is with the Sheriff's Office, their Chief Deputy of Administration, is the appointee on behalf of the Sheriff, and Mr. Gammon, who has served with us for a long period of time, is not going to be with us for a while, so Mr. Russell is here, and welcome, Mr. Russell, to this committee.
Thank you.
Okay, let's see. Workers' Comp and OJI. Mr. Good.
Good afternoon. I'd like to report for both October and November. You'll have the report there in front of you. In the month of October, we had a total of 23 injuries. You can see the breakout if they were there. At that time, at the end of October, 117 of them were OSHA recordable. On the next page, you can see the dollar breakout for the month of October. The total net dollars incurred for that month was $25,459. As the breakout for the Board of Education, 17 of those accidents were with the Board of Education. Total dollars incurred were $19,599. 5 were with the County General, and that had $5,260. And the remaining of the injuries were with the Highway Department, and total incurred dollars were $600. In the month of November, we had 18 injuries. You see the breakout there. That brings the total for the year to date to 194 claims. The OSHA recordables for the end of November was 128, of which 48 for the year were restricted claims, 29 were lost claim days, and 51 were all others. For the month of November, the total incurred dollars were $74,989. The Board of Education had 10 claims, which had a total dollar incurred of $70,369, and the Board of Education had the other 8 for $4,620. If you look at the last page, you'll see the graphic depiction there of the claims for the year to date. It is up and down, but I would like to say, I know you'll look and see there in the month of November that it looks like this year was a little high in the month of November. That's true, but for year to date, we're down about 15% as far as accident claims this year as versus last year. Are there any questions?
Any questions of Mr. Good? Mr. Good, we had 4 claims at the Board of Education which appear to be substantially larger in claim that we've allocated, claim cost. I mean, were they something unique about those 4, or is this, would you give us a little bit of...
There were a couple that had the potential to be severe injuries. Now, of course, when you incur the dollars, you incur it on what you think the claim will be, right, not what it's actually going to be, and it's awful early in the claim history to be able to identify whether those claims are going to come out at that expense or not, okay, since it just happened in the month of November.
Okay. Anybody else want to make any comments on that? So would you say that we're still doing very well?
Oh, very well, yes, sir. Being that the claims themselves are down by 15%, yes, sir.
Okay. And even though we're a little bit up November of last year, we're still low comparatively speaking.
Yes, sir.
November was a very, very good year the last 2 years, wasn't it?
Yes, sir. And if you look at the summer months, the Board of Education, we put a real push on for the Board of Education during the cleaning, and you'll notice that for 3 months in a row there in the summer months, we were very steady. We were very conscientious with the mopping of the floors over at the schools and things, the re-waxing and all. And in past history, we've had quite a few claims, and some of them were very severe during the summer months because of that hazard of waxing and stripping of the floors. But this year was a very good year for that.
Well, we thank everybody, especially the Board of Education, for their attention to all of this. It helps everybody. Everybody, it really does. Okay, thank you then, Mr. Good.
Thank you.
Let's see, we're going to have a wellness update. Are we healthier?
Hi, I'd like to report for October and November. In May 2010, Coordinated School Health sent an employee survey out asking about our wellness. And we learned a couple things from that. One of the things that we learned is many of our employees associate the program name Get Rather Fit with only the Biggest Loser contest. And as you guys know, we've expanded our wellness program to include stress management, financial fitness, and be more of a total wellness package. Since then, we were in a contest to rename the wellness program, to give it a new face, and we have got a winner. Our new name is going to be Smart Steps, and Josh Kubley from the Board of Ed won our contest. He is going to get a trip to anywhere he wants to go from AAA. Our employee appreciation was October 23rd at Lane Agri Park. We have about an estimate of 1,300 people in attendance, and we had 315 flu shots administered at the event. Our financial wellness for November was a couponing class. It was an introduction class taught by Ann Haney, and we had 106 people in attendance. And the Heart Walk was November 7th at MTSU campus, and we had 19 employees attend. Our final HRA off-site clinic for this year was completed at the Board of Ed with 38 people taking their HRA. The upcoming Care Here webinars for January are basic nutrition, how to use an online food journal, and meal planning. And they're offered various dates and times. And you can check the wellness tab at the carehere.com site for the exact listings. The upcoming events This Monday is the advanced coupon class at the Board of Ed from 5 to 7. And if you would like to attend that, you can call 898-7715 to reserve your spot. We're having a repeat intro to couponing class due to interest. That is going to be January 10th from 5 to 7 at the Board of Ed. And Care Here's weight management, Care Here Weight is kicking off January 25th at 5 to 6, and I'm going to announce the location soon. Anybody have any questions?
Would you give us again the new name that has been
It's going
chosen?
to be Smart Steps.
Speak Smart Steps?
Smart Steps.
Smart Steps. Okay. Now, Kelly, you may have already thought about this, and you may already be planning to do this, but in any event, we have the opportunity on our website to showcase or promote whatever activities you have. So it might be good if you would talk to our OIT people about a Smart Step Rutherford Magazine segment or something, okay, just to give more and more exposure to this.
That sounds great. Thank you.
Okay, anyone else want to ask Kelly any questions? Thank you very much. There was a huge number of people at the Employee Appreciation Day, and more people really, I think, are taking advantage of that. Okay, Ms. Stinson, are you handling the dependent audit update?
Dependent audit, I know that it is something that we have been engaged in for several months now within the county. The results from the dependent audit, I want to clarify, are only for those dependents that were on the plan prior to June the 1st, 2010. We are still in the process through tomorrow, which is our deadline, of verifying dependents that have been added to the plan June 1st, 2010 and after. So I encourage all employees who have not gotten their documentation in on their dependents that were added after June the 1st of this year, either through new hire process or open enrollment for the upcoming year, to get their information into the insurance department so we can complete that process. The dependent audit that I am going to speak of was conducted by Secova, that was elected back in early part of this year, to conduct the dependent audit on behalf of Rutherford County. The cost of the audit to the county, including the postage, was $106,000, $106,304. It was $15.50 per employee. It began on June the 14th, and it ended on November the 3rd. There were 6,116 dependents audited through this process. Through that, we verified 5,760 dependents, that they were dependents that met the eligibility qualifications on our plan, and they remain on our plan. We had 356 dependents determined as ineligible, and they were terminated from the Rutherford County Government Medical Plan. The return on investment to the county, as projected by Secova for first-year savings, is at $646,000. So that was a pretty good investment that we had made. The 356 dependents removed. Of those, 160 were removed involuntarily due to not completing the requirements or not responding to the request at all. The remainder of that, which is a higher number, indicates to us that our employees were engaged and they were actively participating in the program, and that the communication style in which we used through the dependent audit was successful. One of the things that we were able to do is to be the test case for Secova on outbound calls, where they were actually reaching out to members who had ineligible dependents identified either because of incomplete documentation or no response. Secova had over 3,000 outbound phone calls that they made, so there is ample opportunity for all employees to submit the information within the required timeline. I'm going to provide you with some statistical information which I feel may be of interest to you regarding the 356 dependents that were identified as ineligible. The children dependents constituted 58.22% of the dependents audited, with spouses representing the remaining balance. Of the 356 dependents removed from the plan, children represented 77.69% of the 356 dependents, with spouses, or 273, with spouses representing 23.31%, or 83 non-verified spouses that were on our plan. I know that there's some questions about the impact of healthcare reform and dependents over the age of 19 that may be added back as a result of healthcare reform, and that impact will occur to our plan on July the 1st. There are approximately 161 dependents that are in the age category of 19 to 25. That could potentially come back onto the plan July the 1st simply because of healthcare reform. Should all of those individuals come back onto the plan, the county would still realize a first-year savings of $413,000. The highest category above age 25 in terms of where did we see the most ineligible dependents existing was the 46 to 55-year-olds. That's where we saw the most activity in ineligible dependents being identified, second to our children category of age 26 and below. Age band 36 to 45 ran a close second. Age 46 to 55 was 4.45% or 28 non-verified, and age 36 to 45 was 4.12%. We learned a couple of things about our employees during this process. One is the communication style in which they respond to, which I referenced earlier. The other thing, and this was of interest to me, Rutherford County government, in terms of a public entity, has a more technologically savvy group than other municipalities and public sectors. Typically, you see about 2 to 3% that utilize the online dependent verification process. We had 617 unique logins, which means 617 employees actually went in and logged in and chose to do the process electronically. Of the 617, we had 478 that actually scanned in their documents and uploaded them to Secova. So I felt that was very useful information to us as we look at other things like open enrollment and other processes that we have within the county to know what the capabilities are of our employee population. I want to thank the insurance department for their assistance. We received a tremendous amount of calls, a tremendous amount of visitors to our department in need of assistance, which we were glad to provide. But for a department of 7, they really buckled down and met the needs of our employees as they were presented to them, and I wanted to thank them for their work during that time period. Are there any questions about these statistics?
Does anybody have any feedback? I mean, I'm sure you saw how many times that we reached out to all of our employees with broadcast emails trying to encourage them to get the information in, and we, I think, really did everything that we possibly could to make this a fair and complete and open and honest kind of approach. But does anyone representing the school board or otherwise, I mean, do we have any feedback that's, I mean, is it mostly positive? I think for the most part, we got a huge number of people just to voluntarily tell us that they had dependents that shouldn't have been there, and we didn't penalize them when they did tell us. Ms. Barnes, you want to make a comment?
I do. I want to ask a question first to clarify, make sure I have this written down correctly. Of the persons determined to be ineligible, 356, which resulted in a cost savings of $626,000?
$646,134.
46, okay. And then if that small percentage of those 19 to 25-year-olds come back on, then we're still looking at around $400,000.
If all of them come back on, which is
come back
161, we're still looking in excess of $400,000 in savings.
So obviously this whole process has been a very good,
successful in terms of identifying the ineligibles. Yeah. And that speaks to one point that I intended to make earlier, which is our purpose of doing the dependent audit was to not create a burden for those that have the eligible dependents. We wanted to assist and to be opportunistic in them having ample opportunity to provide us with the documentation, but to identify those that through whatever course had not been removed from the plan.
Okay. And then I have a second question. I know tomorrow ends the deadline for those persons hired after June 1 or who have brought in dependents after June 1.
That is correct.
Where are we in that process? How successful have you been?
I had looked at some reports initially this morning, in particular to the Sheriff's Office. As an example, I had sent out a communication yesterday with a list to all of the directors and to yourself, Ms. Barnes, that showed who we have incomplete status on. The Sheriff's Office had maintained a list of all employees who had been hired June the 1st, and they provided that to us, and we went through their particular list and looked at that and provided them some feedback on whether it's incomplete or no response at all. In looking at that particular list, if that was a representative sample, it's probably about a 60-40 in terms of 40% who haven't done anything and 60% that still have some element of information outstanding.
And then I have one more question, if I might.
Yes, ma'am.
Do we have anything to report on yet regarding open enrollment this year?
In terms of the numbers,
The numbers
I did bring some numbers actually.
thank you.
I can provide you with, are you interested in seeing the transition from one plan to another? Okay. Okay. And I'll give you the number of, I'll give you the transition numbers. That's what I brought with me today. In 2010, our enrollment for Access Plus, or Option 1, was at 545. In 2011, we were going to be at 527, okay? Option 2 was at 1,381, and in 2011, we're going to be at 1,465. The HRA was at 454 in 2010, and we're at 445 in 2011. So, and it was reasonable to expect to see the spike in Option 2 elections with the 2 new schools and, just our general new hires that we've had.
Mrs. Stinson, through the course of this dependent audit, have we determined some things that we can do or initially in the process that would, I guess you could say, minimize the number of people that get placed in the system that shouldn't have been placed there?
Yes, sir. Thank you for your question. Ongoing, we are, any new hire that comes in, they will be provided a letter that indicates to them that they have 60 days from the date of hire, 30 days to make their elections, and then an additional 30 days beyond that to provide us with the dependent verification. In the absence of them doing that, their dependents will be removed from the plan, and they will have an opportunity to re-add them at the following open enrollment. And they will be notified of that during their new hire orientation as well. So there will be various points in which they'll be provided that information about the new hires. I know that for the Board of Ed and both the Sheriff's Office, they actually have a quick checkpoint list that they give all new hires that says, here's the things that you need to know right now today. Insurance is on that list, and it says you have 30 days to enroll in insurance. I would request that we add to that document some verbiage about the dependent audit or dependent verification process. So we will be verifying each, and then there will be some subcategories that we will reach out to periodically over the years to re-verify.
Okay, that's an excellent report. Anybody else want to make a comment? Mr. Hall?
I just wanted to ask, whenever I was just looking at an old handout that you gave us, and I just wanted to ask again about and it was about the health care bill. If any of these people that were, they're off the insurance rolls now, any of the coverage that they received, they weren't sent a 1099 or anything like that for the amount of their coverage?
No. The intention was to get the ineligible off. We didn't do anything in terms of...
That's what I thought. That's what we wanted. Yeah, that's what we wanted. Yeah. I was just noticing on one of the handouts I got earlier, though, that was, it looks like in the future, it says in 2011, this may be, 6 months old, but it was, if a person is deemed that they were not eligible, then we are, it doesn't say obliged or obligated yet or whatever it says, but we're supposed to send them a 1099 for their medical services if they are not supposed to be on the plan. I thought maybe whenever they, at an enrolling time, if they need to know that in the future from now on, if that turns out to be exactly the way it is, that we have to 1099 them for the federal government to recover some type of taxes on it, I guess. That they know that, so they wouldn't be taxed on it later on or something.
Sure, and that is a good point. We are actually in the process of finalizing the contract with our healthcare reform consultant, so they've not begun that process, but any element like that will be included in our practices going forward. There's been some modification to the reporting guidelines as far as 1099s are concerned, but anything that is applicable will be included.
Okay. If there are no other questions, then we're ready for a Board of Education update. So,
right. This is just more of a notice. Mr. Cornelius from the Rutherford Education Association joined us back in August and indicated that REA, along with the Tennessee Education Association, would be conducting a state plan versus county plan. And I wanted to provide an update to the Insurance Committee based on an email exchange that Mr. Cornelius and I had recently. It appears that the Board of Ed, or the REA, has suspended their review of the state versus county plan at this time. The state has made some substantial plan changes that are effective January 1st, 2011. There's a 19-page question and answer that was provided to employees to try to address some of the changes, to tell you how in-depth those changes were. The Tennessee Education Association advised the REA that it would probably be in their best interest to suspend the review at this time. They said that immediately they could determine that they could not match the Care Here on-site clinic benefit that the county provides. There was comment made regarding the retirement benefits and the difference in the county versus the state to the REA, but that overall it was in their best interest to suspend that and see kind of what the effect of the plan changes were in 2011 to the teachers, and they will readdress that later on in 2011. So I just want to provide you with that update.
Okay, any questions regarding that? If not, tell us what we want to hear about the narcotic management program.
On November 10th, Cigna met with myself and Ms. Nolan to provide the annual utilization review report. And we identified in that report some opportunities for us to improve the service that we provide through our medical plan to our employees. There are certain edits that are generally in place that the county doesn't currently have for our medical participants. An example of that would be refill too soon at retail. Most of us are accustomed to, we have a 30-day prescription, we get it filled, we expect to be able to go back close to the end of that 30 days and refill it. That edit was missing from Rutherford County's plan. There are some other edits along those lines that we discussed, and one of the plans that we discussed was the narcotic management. Cigna took our third quarter results and they pulled the claims in pharmacy experience, pharmacy in particular, and looked at it to see how our utilization patterns were. And it revealed that we have 40 employees currently in our population that participate in the medical plan who have the potential to be overutilizing or misusing narcotics. And of course, with us not only managing our medical plan, but also our OJI, that throws up red flags to us. So we want to be able to better assist employees who have narcotic prescriptions to utilize them in the best format. Because of the way the program is currently designed, in the absence of this, someone could get a prescription from one doctor and go to CVS. They could get a prescription from another doctor and go to Walgreens. And in the absence of this narcotic management program, there's nothing to link that information to say, hey, this employee may have a situation that needs to be addressed. So this is a program that I felt was worthwhile bringing to the committee and requesting approval on. The prescription drugs, as some general information, account for between 25 to 30% of all drug abuse in the United States, either intentionally or through misled use, overprescribing. Those with the misuse of narcotic meds have health care costs that are 3 times higher than those who take medications as prescribed. The annual cost of narcotic abuser is $7,783 compared to non-abusers' costs who are at $2,668. And that doesn't account for the additional expenses that can be passed through the county through our OJI program due to the altered state of the employee, that they have the potential to either be involved in or create an accident because of the narcotic utilization. In order for the county to engage in this program, it is 11 cents per member per month, or roughly $7,000. The savings projected on 40 members through using some behavioral management, outreach to their physicians to make sure that their primary physician is aware of their utilization throughout, is $88,000. So I feel that it's a worthwhile program that's in the best interest of our employees in the county in general for us to engage in. And I wanted to bring this to the committee for a vote.
Now, Ms. Stinson, is this something we would pay Cigna as a part of their additional review of prescription drugs and the claims associated with those? Is that how this
Yes,
is going
sir.
to be managed?
Yes, so that is correct, and it would pass through the insurance fund as an additional cost.
Okay, you've heard her proposal here. What's your feedback on this? For roughly $7,000, we think we can potentially save $80,000 on an annual basis.
In addition, it's not just the cost savings, but it also affects the well-being of our employees.
I think that's probably even more important.
Correct. And unfortunately, narcotics are easily addictive if an individual is not used to taking them. It could start out with something as simple as a back surgery, and the dependency level becomes quick upon these type of medications. It's not always an intentional misuse, but it is a problem that is created and not easily identified always for the employee, but we certainly can tell that through some claims experience as to what might be happening. And early intervention could help offset some long-term problems.
Mr. McKnight, we'll go with him first. Go ahead, Mr. McKnight.
Well, I got all discombobulated getting the microphone out. How are these people going to be approached? I'm assuming you're filtering the claim activity, and who is approaching them? Is it Rutherford County, or is it Cigna? Or?
It's Cigna. Cigna has a behavioral management team. They will use a patient profiling approach, utilizing the claims and pharmacy information. And these individuals are trained to address the mental state of the individual. They are trained to how to approach them without disengaging them from the process. So it would be a Cigna-based program that would be ran.
What reporting are we going to be given? I think it's a great idea. And I'm ready to give you a motion. I'm just curious as to how this thing's going to work.
I had provided you all with this particular documentation. There is included in there some sample reporting, and that reporting will give us total medical cost reduction broken out by emergency room, outpatient, or pharmacy cost, and any other costs, pharmacy that we feel is directly related to the utilization of the medication that creates the problem.
Now, I see that it's like page 21, 22, 23. I'm sure there's more data. Is that?
This is the standard reporting format. Based on our results, Cigna has been very good about any customized reports that I've requested to give me additional. This is their base package report that they would provide back to us. We would not get detailed individual information. That's not really of interest to us. We are more so, like I said, concerned about the welfare and well-being of our employees and looking at it from that perspective.
When would this begin?
If we implemented it, it would begin on January the 1st.
I move, if you're ready to take a motion.
Yes, we're always ready to take a motion. We have a motion to approve the implementation of the narcotic management program. Now, we need a second. Was that Ms.? Okay. Now, Mr. Hall had a question.
I was just kind of curious how it worked too, and I was curious if that includes. I think Medicaid does a pill count. They call the customer who gets it to come in 10 days into their to count their pills at the pharmacy and stuff like that. Is that similar, something that they do, or is that not?
Say that. I'm sorry, Mr. Hall, I can't hear you very well. Could you say that again?
I was just asking some of the implementation, like he was talking about. I think that Medicaid does a pill count where the person is called back to the pharmacy to count the amount of pills that are left in the bottle, stuff like that. I didn't know if that was something that was part of what they did, or if it was just where they called them and said something to them.
Yeah, no, sir, it's not. But they would be able to monitor it through the claims and put any edits or anything like that in place that we need to prevent them from getting refilled too soon.
Okay. Ms. Grace.
I just had a question. Let's say somebody has 3 days worth of medication left and they're fixing to leave on a 2-week vacation, something like that. Will there be a way for them to go ahead and get it filled in special circumstances?
There is always an override process that we can tap into if we need to in a situation like that. I'm sure that there's a program at Cigna, I don't know what the name is called, for vacation. That's pretty typical in claims management, but certainly that would not be a situation that we couldn't avoid.
Other questions? Mr. Hester.
If this is something that's approved today to start January 1st, is this something that would continue year after year, or would it be advisable to try to approve it for a 1-year trial period based upon results, then continue?
Annually, Cigna provides us with their rates for the upcoming year, so we would have on an annual basis to modify what offerings that they have based on the results. So certainly we could do that at the time that we go forward into the coming year.
Okay, other questions? Any discussion? Okay, we have a motion to approve this narcotic management plan. If there's no other discussion, you're ready to vote. Everyone in favor of this, please say aye. Aye. Are there any opposed? Okay, let it reflect it's unanimous. Okay, reappointment of committee members. We have sort of been a bit negligent in that the at-large members are serving a bit beyond their time, you might say, that being Mr. Sellers, Mr. Hall, Mr. Hester, and Mr. McKnight. And we have been in touch with all four of these gentlemen, and three of them wish to continue to serve, and I am going to, since they've all been, every single one of them have been really good participants and members, I will be reappointing three of them. Mr. McKnight has chosen not to continue to serve with us, and we regret that, but we thank him for his service. So I'll be putting forward your names again for reappointment as members at large, and then I will be trying to determine another person as the fourth member at large. So if any of you have any people you'd like to suggest, I would certainly entertain receiving those names, but I just wanted to make that announcement. Okay, anyone else have any other business that we need to discuss today? Okay, if there's no other business today, thank you very much, and the meeting is adjourned.